good evening friends. This is Colonel Pradeep Pendyala, Professor of Anaesthesiology. Friends, would you believe if I say anesthesiologists are saviors of the world, especially during a pandemic? Let me explain how. They are experts in physiology, the anesthesiologists. They are experts in physiology, pharmacology and physics. And they do know everything about cellular respiration and how drugs work and the internal working of a defibrillator, ventilator. That's very important, the ventilators. Anesthetists do work with emergency medicine, critical care, and they are the pain specialists. They protect the body from collapsing. Let me tell you a few things in detail. During the COVID-19 pandemic, one specialty, the modern medicine that has emerged into the limelight is anesthesiology. Previously, anesthetists used to be people behind the curtains. But in COVID-19 times, things have changed. They are emerging, the anesthesiologists are emerging as doctors working in ICUs, isolation wards, and sharing the burden of physicians. Now, you would ask me, what exactly are anesthetists doing? This is quite obvious question because you have been watching them during the surgeries, only during surgery, and you see them entering the operation theatre before the surgeon and slip out after the surgery quietly as you do wait outside to meet the surgeons anxiously. But during the pandemic, they have been working in isolation wards and taking care of patients. Anesthesiologists are experts in emergent airway management, acute and intensive care. They know exact time when you should be intubated and when you should be put on a ventilator. This expertise helps open collapsed lungs, improve your oxygenation, and decrease the strain on your lungs and help your lungs to heal. Friends, as per the American Society of Anesthesiologists, the primary roles of anesthesiologists during surgery are to provide continual medical assessment of the patient, monitor and control the patient's vital life functions, including heart rate, rhythm, breathing, blood pressure, body temperature, and body fluid balance. An anesthesiologist is a doctor who gives a patient medication, so they do not feel pain when they are undergoing surgery. However, these specialists, the anesthesiologists, play much more wider role than just putting people to sleep during surgery. They are involved in a range of other medical procedures, including carrying out assessments in critical care units, dealing with emergency situations, and giving advice about pain management. The core element of the anesthesiology specialty is the study and use of anesthesia to safely support a patient's vital function through the perioperative period. Since the 19th century, anesthesiology has developed from an experimental area with non-specialist practitioners using novel, untested drugs and techniques into what is now a highly refined, safe and effective field of medicine. In some countries, anesthesiologists comprise the largest single cohort. Doctors in hospitals and their role can extend far beyond the traditional role of anesthesia care in the operating room, including fields such as providing pre-hospital emergency medicine, running intensive care units, transporting critically ill patients between facilities, and rehabilitation programs also. On regular days, the work of anesthesiologists begins when the patient is admitted to the hospital and ends only after the full recovery. They also play a critical role during the surgical process, keeping an eye on the fluctuations of vital parameters like blood pressure, oxygen saturation, urine output, and respiratory rate, apart from ensuring that the procedure remains pain-free. Anesthesiologists are usually called up for inserting intravenous injection lines, inserting food pipes, intubating ventilators, putting the patients on ventilators, and managing extremely critical cases. Let me repeat, for managing extremely critical patients. People know normally anesthesiologists that they put them to sleep during surgery, but they usually forget that anesthesiologists are the only people responsible for ensuring that they wake up well after the surgery. Moreover, their role in critical patients who are on verge of losing life. Let me repeat it. Moreover, their role in critical patients who are on verge of losing life and in reviving almost dead people through a medical procedure called CPR, cardiopulmonary resuscitation, is unimaginable, and they are the best in making almost the dead people revive with a procedure called CPR, cardiopulmonary resuscitation. Hence, I am sure if I say anesthesiologists could be called saviors of the world, especially in a pandemic and also after the pandemic. Thank you for patient listening. This is Colonel Pradeep signing off for tonight. Take care. Until next time. Bye-bye.